COVID subvariants BA4 and BA5 continue to emerge across the state, this at a time when immunity from initial vaccines or booster shots may be waning.
Natalie Kuchko sat down with Monroe County Public Health Commissioner Dr. Michael Mendoza to ask about the severity of these variants and the likelihood of reinfection. She joins us now. Natalie.
Adam, Teresa, Dr. Mendoza says BA5 doesn't appear as severe as previous variants. However, the case for reinfection may be more likely, he says, given the fact that immunity may be wearing off.
The reality is there's no reason to think it's not here already.
As subvariants BA4 and BA5 make up a little more than half of current COVID cases in New York, Monroe County Public Health Commissioner Dr. Michael Mendoza says the variants aren't as severe, but may be more contagious. When it comes to the possibility of reinfection, he says it's not out of question.
They seem to be happening more quickly, and it is possible that they may be more likely, given that the immunity that we have is based on what we've been vaccinated against and or what we've been infected with. So if somebody hasn't been infected with either of these subvariants, we think that they're going to be susceptible, again, because the initial vaccine may not be as effective against preventing from these subvariants.
Dr. Mendoza says he anticipates more people would get reinfected even if they were sick with COVID in the spring. Right now, the FDA is looking at the possibility of second booster shots from Pfizer, Moderna, and Johnson & Johnson.
Is there any harm in getting those vaccines? No. Is there much benefit? We don't know. So there's a lot of debate, a lot of studies happening right now looking at whether an Omicron-specific booster is necessary, and we think that perhaps, by the fall, that may become a reality.
Mendoza also stresses the importance of reporting at-home COVID tests to provide more accurate numbers countywide.
The concern is that we don't know all of the testing that's happening in the community because people aren't recording them. So we believe that what we're reporting is accurate because people are telling us, but we just know that not everybody is telling us.
And Dr. Mendoza says it's safe to assume the majority of new cases are likely the newer subvariants. He says it will take a few more weeks before the local case numbers can identify them. Adam, Teresa?
All right, Natalie, thank you. When it comes to the possibility of another mask mandate in Monroe County, Dr. Mendoza told us today right now he does not feel it's necessary. He says the existing recommendations to wear one based on risk or comfort level will remain going forward.